We need to talk about uterine fibroids and their impact on more than 75% of women. You will take away from this video a clear understanding of what uterine fibroids are, including the various types, the symptoms, causes, and risk factors, and how they impact some women differently than other ethnicities. Being informed is taking a proactive approach in your health, which is essential to receiving the best care. Informed patients will be able to feel more confident when discussing their health with medical providers. Uterine leiomyomas, commonly known as uterine fibroids, are abnormal growths in the uterus that are considered benign, meaning non-cancerous, tumors. Cancerous fibroids known as leiomyosarcomas are very rare. Uterine fibroids are made of smooth muscle cells and fibrous connective tissue. They range in size from a green pea to a softball. However, in rare cases, they can grow to the size of a watermelon, giving women the appearance of being pregnant. You may be thinking, what size of fibroid is the most dangerous? While larger growths can increase symptoms and require hospitalization, any size of fibroids can cause complications that impact the uterine lining. Warning: the following images are of fibroids that have been excised from a uterus. Shocking. I know. But what is even more shocking is that uterine fibroids are one of the most common yet understudied diseases in women. Thankfully, most women are asymptomatic. Symptoms can include heavy menstrual bleeding, severe cramps, frequent urination, bloating, back pain, constipation, pelvic pain and pressure, recurrent miscarriages, and infertility. It is important to inform your healthcare provider if you are experiencing any of these symptoms, as some will require intervention. There are 4 types of uterine fibroids. Subserosal fibroids are the most common and grow near the outer layer of the uterus. In contrast, submucosal fibroids grow into the open space inside the uterus and are uncommon. Intramural fibroids are the hardest to remove as they grow in the muscular wall of the uterus. And pedunculated fibroids are the most painful as the stalk can twist and cut off blood supply to the growth. Complications from uterine fibroids can include impact to the uterine lining, damage to the uterus as a whole, ruptures, causing sudden, extreme pain, blood clots, and continuous bleeding over several weeks. While the exact cause of uterine fibroids are not known due to a lack of research, certain chemicals in beauty products like hair relaxers and hair dye contain dangerous carcinogens or hormone disruptors that increase women's risk of developing fibroids over years of consistent use. If you are curious about the safety and impact of chemicals in your beauty products, check the video description for links to CosDNA and Environmental Working Group's Skin Deep databases. Both sites rank the ingredients of popular beauty products, making it easier for you to make more informed purchases. Additionally, known factors that can increase the risk of developing fibroids include age, family history, obesity, and ethnic origin. Unfortunately, uterine fibroids disproportionately affect Black women. More than 75% of Black women will be diagnosed with uterine fibroids during their lifetime. Most experiencing them in reproductive years, but they can develop at an earlier age. They are also more common and severe and can have different growth patterns. Countless brave women have shared their experiences with uterine fibroids across social media, enabling others to find support, community, and referential information, indirectly countering the lack of research done on uterine fibroids and spreading awareness. Celebrities like rapper and actress Eve, supermodel Beverly Johnson, model and actress Cynthia Bailey, and singer-songwriter/dancer FKA Twigs have publicly spoken about their experiences with uterine fibroids. In an interview with Vogue magazine, FKA Twigs discussed the mental, physical, and emotional turmoil caused by uterine fibroids and her 2017 surgery where 6 fibroids were removed that she likened to a daily fruit bowl of pain. She also expressed her realization in the gaps in healthcare for Black women, stating, "To be honest with you, when I first started properly looking into it, it made me really angry. I just started to see what a disadvantage women of color are at." According to a study published in the National Library of Medicine, African American women have high treatment expectations, more financial obstacles, and are less satisfied with their treatment outcomes than women of other racial and ethnic groups. Black women are less likely to have their pain and symptoms taken seriously by doctors due to well-documented racial disparities in healthcare. Therefore, it is critical for women to educate themselves, advocate for their needs, and find community and support in whatever way possible. Having conversations with the women in your life about uterine fibroids can make a significant impact in their awareness, education, and early detection, leading to better treatment outcomes overall. But don't just stop there. We need to talk about supporting legislation for uterine fibroids. Did you know in 2020, then Senator, Vice President Kamala Harris introduced Bill H.R. 6383, the Uterine Fibroid Research and Education Act of 2020, which was sponsored by New York Congresswoman Yvette Clarke to provide new funding for crucial research and education on uterine fibroids. Supporters of the bill included the Society for Women's Health Research, Black Women's Health Imperative, National Hispanic Medical Association, the White Dress Project, and other key stakeholders. The bill was referred to the House Committee on Energy and Commerce but did not pass. The following year, Congresswoman Clarke introduced a new version of the Bill H.R. 2007, the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act of 2021. Named in honor of the late Ohio Congresswoman, Stephanie Tubbs Jones, who pushed for federal funds to research uterine fibroids and bravely advocated on behalf of people impacted by the health disparity gap. Her legacy also includes the Stephanie Tubbs Jones Health Center that was opened in 2011 by the Cleveland Clinic to serve the health needs of patients in East Cleveland and surrounding communities. Bill H.R. 2007 was again referred to the House Committee on Energy and Commerce, this time being considered by the Subcommittee on Health. Despite having 126 co-sponsors, all who happened to be Democratic congresswomen and men, it still did not pass. This did not deter Congresswoman Clarke, as she persisted, and reintroduced the Bill H.R. 4572, the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act of 2023 in July of that year, which happens to be Fibroid Awareness Month. The bill has been referred to the House Committee on Energy and Commerce's Subcommittee on Health again, where these 29 members of Congress hold the power to advance the bill. With uterine fibroids costing the United States an estimated $5.9 to $34.4 million a year, it is imperative that our government be proactive in supporting women's health initiatives like Bill H.R. 4572. President Obama said this about Congresswoman Jones: it wasn't enough for her just to break barriers in her own life, she was also determined to bring opportunity to all those who had been overlooked and left behind. And in Stephanie, they had a fearless friend, an unyielding advocate. So, be unwavering and determined and advocate for women's health like Congresswoman Jones and Congresswoman Clarke in support of research, education, and treatment for uterine fibroids. You can pause the video, here, and screenshot a template of a letter to your congressperson expressing support for the bill, which can be emailed or sent via regular mail. Check the video description for links to help you find your congressperson's contact details. In the next video, we will discuss how uterine fibroids are diagnosed, and the various treatment options available to women that don't require removal of the uterus, medically known as a hysterectomy. If this video has been helpful to you in any way, please give it a like, share it with the women in your life, and subscribe.